HIPEC treatment is used really for any cancer that is spread inside the abdominal cavity into the peritoneal lining. Most commonly, we use it for GI cancers such as colon cancer, appendix cancer, or small intestine cancer. Occasionally, we recommend it for patients with other types of cancers such as gastric cancer or pancreatic cancer. The HIPEC procedure really has three parts. The first part is an exploratory component. That's where we take a look inside the abdomen and assess how much disease there is in the abdomen. Sometimes this part can be assisted by a laparoscopic exploration, which is done a few weeks ahead of the main surgery. It helps us assess the burden of disease. Once we've made a determination of how much disease there is, we move on to the cytoreductive surgery component, which is the second part. In that component, we look around to see where any tumor has spread inside the abdomen, into the peritoneal surfaces of the diaphragm or the pelvis, onto the bowel, the stomach, the spleen, the gallbladder, any other areas. We remove any disease that we can see and any necessary organ resections at the same time. Once we've completed that part, we then proceed to the HIPEC part of the procedure. In that part, we give intraperitoneal chemotherapy for about 90 minutes, and that chemotherapy is heated up with a special pump that circulates it at high temperature. We think that makes it more effective at killing microscopic tumor cells. The HIPEC procedure is helpful for patients who have cancer that's spread inside the abdomen into the peritoneal lining. And for those patients, historically, we didn't consider that there were surgical treatments available. As we've matured our approach to the HIPEC procedure, we've discovered that these patients can enjoy time off of chemotherapy in many cases, and oftentimes we think that we've extended those patients' lives as well. The HIPEC procedure is a major surgical operation, and so patients are in the operating room most of the day on the day of the surgery. They recover in the ICU for the first few days. Most patients are in the hospital a week or two. Most of that time is waiting for the bowels to begin to function again after the surgery. After that time, patients go home and recover the rest of their physical strength and get their nutrition working. That usually takes a period of a month or two to be fully back on track. So coming to Johns Hopkins for HIPEC surgery is important for a number of reasons. The first is that we have specialists here, such as myself and others, who deal with tumors in this location. And so having a specialist surgeon as well as specialist medical oncologist is very helpful in this scenario. The other thing is part of our big team approach. It's not just the surgeon that makes the difference in the patient's recovery from surgery, but actually it's the anesthesiologist, our ICU teams, our nurses, our residents and fellows. All those make a big difference for the patients in their recovery, and we really think that it's that team approach that benefits patients the most.